Peter, Professor Ken, and all these distinguished guests from near and far. Good morning. Actually, if you look at today's agenda, I think it's mostly about precision medicine. And tomorrow we have a kind of a joining conference. It's more about the hospital side of the learning health system. So as you can see from the flagship program, the learning health system activity or initiative in Taiwan has a very close link to the promotion of precision medicine. Okay, but I'm not going to talk a lot about precision medicine anyway, but I'm more on the learning health system concept side. Okay, so if you want to learn more about learning health system in a hospital healthcare organization, then I will also encourage you to participate tomorrow's conference in the same place. Okay, so this is kind of an advertisement. Okay, about a little bit about myself. I'm a professor in biomedical informatics, and a fellow in the American College of Medical Informatics and several other places. And I'm also a dermatologist, so I'm also seeing some patients. So a little history of the medical knowledge and its infusion into practice. Before 1990s, actually there's not this term called evidence-based medicine, which we're all too familiar with. Before that, it's called clinical epidemiology. And most people would understand what that is about, you know, by looking at the name. And then before that, it's just epidemiology, right? So since 1991, EBM, or evidence-based medicine, is like Wi-Fi. You know, everybody start to recognize this is probably the right direction. And now it's spread to all over the world and into all medical education and clinical practice. So it's not something that we argue about anymore. It's a concept that everybody follows as much as, you know, the information that we have at hand. And this movement, I would actually link that to medical errors and patient safety movement starting in 1999. People know about the famous IOM report. About, in 1999, I think the report is called To Earth Human. And in the year 2000, there's another report called Crossing the Quality Chasm. People might be familiar with these reports. And these also speed up the integration of knowledge into medical knowledge into clinical practice. And after 2007, the IOM, or National Academy of Medicine, started to coin the term learning health system or learning healthcare system, and started publishing a lot of books. Oops, where are the books? Okay, I kind of missed the books. Anyway. And they actually published about 15 books on the topic of learning health system, which actually inherit a lot of concepts from EBM, the patient safety quality thing. On the other hand, precision medicine or translational medicine before precision medicine is also about how we translate what we know, what we learn in medical research into clinical practice. So translational medicine, in a broader sense, well, actually also is the kind of the primer for learning health system. So we have a planning that we want to establish a consortium so we can learn together. Everybody knows that, you know, one person, I mean, two heads are better than one, right? So I forgot it. The saying, but anyway, so if we have a group of people that can learn from each other, I think it will speed up the learning and make the learning more interesting. So stage one, would like to build the alliance from Taiwan's healthcare organization, learn from the experts around the world, like people like you today. And we're going to talk about EHR, clinical data warehouse, standards, and other infrastructure. And stage two, that will starting now. These are kind of you know, things that we have done. We will try to build incentive system for healthcare organizations to invest on learning health system. Apparently, it's something that you need to really actively invest upon. Learn and share through datathon or hackathon. That's some of the activity that we're going to be doing in August this year. Well, actually, yeah, October or August this year. And we have been actually through a datathon in Melbourne. And actually, in the past several days, we kind of had a hackathon with Ellen. So we run through what we have in the hospital and look at how to run it. And produce reports and journal papers, of course, so we can share to a wider audience. Stage 3, we would like to promote the government to provide more incentives and policies to sustain learning health system. And as we will see, actually, Peter and Ken, they're very good at policy promotion. So we do have a policy about it from the government. Data and knowledge sharing through interoperable systems. And this is probably more knowledge sharing than data sharing in this context, because we talk about data sharing a lot for quite a while, and there are inherent problems that cannot be, well, it's hard to overcome if we only look at data sharing. But it seems like people are more willing to share knowledge than data sometimes. And we also have plans to disseminate this whole knowledge that we've learned to the Asia-Pacific region and of course other places around the world. This is what happened last year with Peter and his team. This is in July last year. We have the first Learning Health System Conference and the second Learning Health System Conference is in December. And we also got our experts' agreement to start this the preparation of the consortium. And this is one of the it's mostly Chinese, but you can just see the English here. This is one of the policy statement from the so-called 10th National Science and Technology Conference. As you know, this country, Taiwan, or sometimes Republic of China, has been more than 100 years. So it's only 10th, that means it's really quite important, 10 meeting among the anyway, so one of these policies about collaborating with medical center and integrate the learning health system into our healthcare practice. And also, this is precision medicine. I didn't actually translate. Precision medicine and clinical decision outcome research. So the backbone of promoting learning health system in Taiwan is actually for precision medicine and clinical decision and outcome research, which is quite appropriate. So we all know about this famous, kind of a semi-circular, a two-stage cycle for learning health system. On the left-hand side is the, of course, I borrowed this slide from Dr. Chuck Freeman. On the left-hand side, he called it the efferent arm, and it's data to knowledge. On the other hand, the efferent arm will be knowledge to practice. And we both know that these two arms, they are difficult. They are not easy, right? People have been doing this, for their whole lives, and also this. It's not easy. So in order to make it a little bit more, easier to implement, we try to decompose the knowledge to practice arm. We kind of extend it to, from data to knowledge, from knowledge to practice, and from practice to consumer, and from consumer back to data. So it sounds more like this is kind of a modified version, but under the same umbrella of learning health system. So from data to knowledge, it's about, of course, human curation. We're still doing it, like the librarian is doing it. Statistics, data mining, and now we're also using machine learning and other artificial intelligence methodology to do this data to knowledge, to try to to find more knowledge from the data, especially when we have big data. Of course, people have different interpretation of how big is big, right? Actually, big data is more about complexity than the size. Of course, size also matters. But anyway, we have many different algorithms that's now available, so we can do data to knowledge. The second part will be from knowledge to practice, and so from knowledge to practice, we use guideline, again EBM, and decision support, and try to influence the practice of the clinicians. And once we change that, we also want to change what the consumer will behave. Because if we have convinced that this specific therapy or treatment is effective to a certain disease, and the clinician also issue that treatment or prescribe that treatment, but the consumer wouldn't follow, then it becomes also a problem. So P2C would actually address health literacy, consumer health information, and also compliance of the consumer. And then from consumer, because we talk about outcome research, so we need to collect data from the consumer. Like now, in addition to electronic health record, we have personal health record. In Taiwan, we call it My Health Bank. So everyone could just log on and access all their healthcare data in the past 2 years. Only 2 years for some reason. And also a lot of health IoT, the Internet of Things, like wearable devices, like tiny measurement sensors. So these are all the data that we could gather from consumer back to our data repository. So when we say data, we're not limiting ourselves in the hospital data. We also want to collect all the behavior data, lifestyle data, among others, right? So so we kind of extend D2K, K2P to P2C and C2D. Okay, a lot of acronyms. And this is the partners that we are currently planning, because since it's more the Asia Pacific region, so we kind of plan to. That's why we actually invite quite a few people from this region, a few experts from this region. So tomorrow we have experts from India, Vietnam, Pakistan, Australia, and people from this region that would, and Singapore, that would actually share with us what's the progress in this region and what could be the next step. And of course, a lot of these concepts we learned from the US, especially from the University of Michigan, where Dr. Evan Wayne came from, and his colleague, Dr. Chapman. So that's about it. I'm open to some questions. I still have some time, so I'm open to some questions, and hopefully we have very successful and stimulating meeting. Thank you.